Welcome to Bushra World Channel. Please subscribe and share.
Keep yourself and others safe, do it all. Protect yourself and those around you. Get vaccinated as soon as it's your turn and follow local guidance on vaccination. Keep physical distance of at least 1 meter from others, even if they don't appear to be sick. Avoid crowds and close contact. Wear a properly fitted mask when physical distancing is not possible and in poorly ventilated settings. Clean your hands frequently with alcohol-based hand rub or soap and water. Cover your mouth and nose with a bent elbow or tissue when you cough or sneeze. Dispose of used tissues immediately and clean hands regularly. If you develop symptoms or test positive for COVID-19, self-isolate until you recover. Wear a mask properly. To properly wear your mask, make sure your mask covers your nose, mouth and chin. Clean your hands before you put your mask on, before and after you take it off, and after you touch it at any time. When you take off your mask, store it in a clean plastic bag, and every day either wash it if it's a fabric mask or dispose of it in a trash bin if it's a medical mask. Don't use masks with valves. Make your environment safer. The risks of getting COVID-19 are higher in crowded and inadequately ventilated spaces where infected people spend long periods of time together in close proximity. Outbreaks have been reported in places where people have gathered, often in crowded indoor settings and where they talk loudly, shout, breathe heavily or sing, such as restaurants, choir practices, fitness classes, nightclubs, offices and places of worship. To make your environment as safe as possible, avoid the 3 Cs, spaces that are closed, crowded or involve close contact. Meet people outside. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without outdoor air coming in. If you can't avoid crowded or indoor settings, take these precautions. Open a window to increase the amount of natural ventilation when indoors. Wear a mask. Keep good hygiene. By following good respiratory hygiene, you protect the people around you from viruses that cause colds, flu and COVID-19. To ensure good hygiene, you should regularly and thoroughly clean your hands with either an alcohol-based hand rub or soap and water. This eliminates germs that may be on your hands, including viruses. Cover your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Dispose of the used tissue immediately into a closed bin and wash your hands. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as door handles, faucets and phone screens. What to do if you feel unwell? If you feel unwell, here's what to do. If you have a fever, cough and difficulty breathing, seek medical attention immediately. Call by telephone first and follow the directions of your local health authority. Know the full range of symptoms of COVID-19. The most common symptoms of COVID-19 are fever, dry cough, tiredness and loss of taste or smell. Less common symptoms include aches and pains, headache, sore throat, red or irritated eyes, diarrhea, a skin rash or discoloration of fingers or toes. Stay home and self-isolate for 10 days from symptom onset, plus 3 days after symptoms cease. Call your healthcare provider or hotline for advice. Have someone bring you supplies. If you need to leave your house or have someone near you, wear a properly fitted mask to avoid infecting others. Keep up to date on the latest information from trusted sources, such as WHO or your local and national health authorities. Local and national authorities and public health units are best placed to advise on what people in your area should be doing to protect themselves. What happens to people who get COVID-19? Among those who develop symptoms, most, about 80%, recover from the disease without needing hospital treatment. About 15% become seriously ill and require oxygen, and 5% become critically ill and need intensive care. Complications leading to death may include respiratory failure, acute respiratory distress syndrome, ARDS, sepsis and septic shock, thromboembolism, and/or multi-organ failure, including injury of the heart, liver or kidneys. In rare situations, children can develop a severe inflammatory syndrome a few weeks after infection. Who is most at risk of severe illness from COVID-19? People aged 60 years and over, and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes, obesity or cancer, are at higher risk of developing serious illness. However, anyone can get sick with COVID-19 and become seriously ill or die at any age. Are there long-term effects of COVID-19? Some people who have had COVID-19, whether they have needed hospitalization or not, continue to experience symptoms, including fatigue, respiratory and neurological symptoms. WHO is working with our Global Technical Network for Clinical Management of COVID-19, researchers and patient groups around the world to design and carry out studies of patients beyond the initial acute course of illness to understand the proportion of patients who have long-term effects, how long they persist, and why they occur. These studies will be used to develop further guidance for patient care. When should I get a test for COVID-19? Anyone with symptoms should be tested, wherever possible. People who do not have symptoms but have had close contact with someone who is, or may be, infected may also consider testing. Contact your local health guidelines and follow their guidance. While a person is waiting for test results, they should remain isolated from others. Where testing capacity is limited, tests should first be done for those at higher risk of infection, such as health workers, and those at higher risk of severe illness such as older people, especially those living in seniors' residences or long-term care facilities. What test should I get to see if I have COVID-19? In most situations, a molecular test is used to detect SARS-CoV-2 and confirm infection. Polymerase chain reaction, PCR, is the most commonly used molecular test. Samples are collected from the nose and or throat with a swab. Molecular tests detect virus in the sample by amplifying viral genetic material to detectable levels. For this reason, a molecular test is used to confirm an active infection, usually within a few days of exposure and around the time that symptoms may begin. What about rapid tests? Rapid antigen tests, sometimes known as a rapid diagnostic test, RDT, detect viral proteins, known as antigens. Samples are collected from the nose and or throat with a swab. These tests are cheaper than PCR and will offer results more quickly, although they are generally less accurate. These tests perform best when there is more virus circulating in the community and when sampled from an individual during the time they are most infectious. I want to find out if I had COVID-19 in the past, what test could I take? Antibody tests can tell us whether someone has had an infection in the past, even if they have not had symptoms. Also known as serological tests and usually done on a blood sample, these tests detect antibodies produced in response to an infection. In most people, antibodies start to develop after days to weeks and can indicate if a person has had past infection. Antibody tests cannot be used to diagnose COVID-19 in the early stages of infection or disease but can indicate whether or not someone has had the disease in the past. What is the difference between isolation and quarantine? Both isolation and quarantine are methods of preventing the spread of COVID-19. Quarantine is used for anyone who is a contact of someone infected with the SARS-CoV-2 virus, which causes COVID-19, whether the infected person has symptoms or not. Quarantine means that you remain separated from others because you have been exposed to the virus and you may be infected and can take place in a designated facility or at home. For COVID-19, this means staying in the facility or at home for 14 days. Isolation is used for people with COVID-19 symptoms or who have tested positive for the virus. Being in isolation means being separated from other people, ideally in a medical facility where you can receive clinical care. If isolation in a medical facility is not possible and you are not in a high-risk group of developing severe disease, isolation can take place at home. If you have symptoms, you should remain in isolation for at least 10 days plus an additional 3 days without symptoms. If you are infected and do not develop symptoms, you should remain in isolation for 10 days from the time you test positive. What should I do if I have been exposed to someone who has COVID-19? After exposure to someone who has COVID-19, do the following. Call your healthcare provider or COVID-19 hotline to find out where and when to get a test. Cooperate with contact tracing procedures to stop the spread of the virus. If testing is not available, stay home and away from others for 14 days. While you are in quarantine, do not go to work, to school or to public places. Ask someone to bring you supplies. Keep at least a 1-meter distance from others, even from your family members. Wear a medical mask to protect others, including when you need to seek medical care. Clean your hands frequently. Stay in a separate room from other family members, and if not possible, wear a medical mask. Keep the room well ventilated. If you share a room, place beds at least 1 meter apart. Monitor yourself for any symptoms for 14 days. Stay positive by keeping in touch with loved ones by phone or online, and by exercising at home. If you live in an area with malaria or dengue fever, seek medical help if you have a fever. While traveling to and from the health facility and during medical care, wear a mask, keep at least a 1 meter distance from other people and avoid touching surfaces with your hands. This applies to adults and children. Is there a vaccine for COVID-19? Yes. The first mass vaccination program started in early December 2020 and the number of vaccination doses administered is updated on a daily basis and at least 13 different vaccines, across 4 platforms, have been administered. Campaigns have started in 206 economies. The Pfizer and BioNTech Comirnaty vaccine was listed for WHO Emergency Use Listing, EUL, on December 31, 2020. The Covishield and AstraZeneca AZD1222 vaccines, developed by AstraZeneca Oxford and manufactured by the Serum Institute of India and SK Bio respectively, were given oil on 16 February. The Janssen Ad26.Cov2.S developed by Johnson & Johnson, was listed for oil on March 12, 2021. The Moderna COVID-19 vaccine, mRNA 1273, was listed for oil on April 30, 2021 and the Sinopharm COVID-19 vaccine was listed for oil on May 7, 2021. The Sinopharm vaccine is produced by Beijing Bio-Institute of Biological Products Company Limited, subsidiary of China National Biotech Group, CNBG. Once vaccines are demonstrated to be safe and efficacious, they must be approved by national regulators, manufactured to exacting standards, and distributed. WHO is working with partners around the world to help coordinate key steps in this process, including to facilitate equitable access to safe and effective COVID-19 vaccines for the billions of people who will need them. Are there treatments for COVID-19? Scientists around the world are working to find and develop treatments for COVID-19. Optimal supportive care includes oxygen for severely ill patients and those who are at risk for severe disease and more advanced respiratory support such as ventilation for patients who are critically ill. Dexamethasone is a corticosteroid that can help reduce the length of time on a ventilator and save lives of patients with severe and critical illness. Results from the WHO's Solidarity Trial indicated that remdesivir, hydroxychloroquine, lopinavir, ritonavir and interferon regimens appear to have little or no effect on 28-day mortality or the in-hospital course of COVID-19 among hospitalized patients. Hydroxychloroquine has not been shown to offer any benefit for treatment of COVID-19. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. WHO is coordinating efforts to develop treatments for COVID-19 and will continue to provide new information as it becomes available. Thank you for watching and be safe.